WHO declared a global public health emergency today. But if you want the number that explains why, it's buried in a field report from Bunia. Contact tracing has reached 45% of cases. Half of what you need to stop this.
This is Ebola Watch, and the headline we've been watching all week finally landed. A P fake. Deaths are over 100, and the CDC is quietly closing the gate.
Today we'll keep two case numbers on the table, walk through what temporarily restricted means at an actual airport, and ask the uncomfortable question: what does a declaration change when the field math is this far behind?
And there's a protest in Bunia outside a US-built quarantine center. So let's start there. On the ground, not the press release.
Let me set the count precisely, because the sources don't fully agree. Reuters has confirmed cases nearly 600 as of June 9th. WHO's Bunia figure had 550 the same day. Same date, two numbers. That's the spread, and I'm not going to flatten it.
Okay, the 45%. WHO's own field director said it out loud. If you're publicly admitting your tracing is at half the threshold, what does the P-fake label add on Wednesday morning that you didn't have Tuesday? Let's get to the part people actually need. The CDC page updated June 9th. Entry temporarily restricted for travelers from DRC, Uganda, and South Sudan. Kara, what does temporarily restricted mean at a gate?
One more honest note on the diplomacy. Tedros spent the weekend asking Uganda to reconsider. The CDC restriction showing up today tells you that appeal didn't move policy before the harder measure landed. Policy moved faster than the conversation. Here's Lisa Schnurring at CIDRAP News.
The World Health Organization late Saturday declared the outbreak of Ebola that was first seen in the Democratic Republic of the Congo an international public health emergency, underscoring the concern about the spread of the virus as travel-related cases were reported in Kampala, the capital of Uganda.
WHO invoked a public health emergency of international concern today, its highest tier of global alert. The label matters, but the operational number matters more. WHO's own field director in Bunia says contact tracing has reached just 45% of cases.
45%. The threshold for control is 90. So WHO declares its top-level emergency, while the field math is sitting at half of what it needs.
That's exactly why the declaration had to happen, Daniel. The fake gives Tedros the formal coordination tool he was reaching for last week. One authority, officially invoked.
And it's a third country in scope now. CDC's restriction covers DRC, Uganda, and South Sudan. South Sudan's new to that list. The map is expanding.
From CDC.
On May 18, 2026, CDC, the Department of Homeland Security, DHS, and other appropriate federal agencies announced enhanced travel screening, entry restrictions, and public health measures to prevent Ebola disease from entering the United States amid ongoing outbreaks in East and Central Africa.
Okay, here's the line I've been waiting on all week. CDC's page updated yesterday. Entry is temporarily restricted for travelers recently in DRC, Uganda, or South Sudan. That's the part that changes itineraries.
And pay attention to the geography, Daniel. South Sudan is the new name on that list. Bringing a third country into scope is a real escalation, so let's name it instead of letting it blur together.
So what does temporarily restricted actually mean at a gate? Because US citizens can still come home. They just get enhanced screening, right?
Right. U.S. citizens and nationals can enter, but they go through enhanced public health screening, then 21 days of self-monitoring after they leave the affected countries. Ebola's incubation can run the full 3 weeks, so feeling fine at the border doesn't clear you.
And this is the same week WHO declared a global emergency, which we covered up top. So the appeal to Uganda we talked about Tuesday, that window closed. The soft diplomatic ask failed, and the hard measure showed up instead.
From Anait Miridzanian at Reuters.
In its latest statement published on X, Congo's government said the number of confirmed Ebola cases had increased to 598, including 115 deaths. It also said that 22 patients had recovered from the disease and that new cases didn't spread to more health zones.
Congo's government put a hard figure on it Tuesday. 598 confirmed cases, 115 deaths posted on X. That takes us from the 450 plus we had to nearly 600.
And the same statement is basically pleading with people to go to health centers and not to attack the workers there. That line tells you a lot about where trust is.
What I'd hold on to? 17 health zones in Ituri, 7 in North Kivu, 1 in South Kivu, and Congo says new cases didn't spread to additional zones. It's the first detail all week that sounds even a little like containment, thin as it is.
22 recoveries too. Small number against 598, but it's the first time the recovered column isn't just 0.
And remember the dates here. It was announced May 15, but officials now admit it ran undetected for weeks before that. So the 598 is counting from a starting line we never actually saw. From Chinedu Asadu and Justin Kabumba at the Globe and Mail.
Attacks on health workers from angry residents, skepticism among some locals, and armed conflict in hotspots continue to challenge efforts to stop the Ebola outbreak declared on May 15th, caused by a severe form of the disease.
Over 100 dead now. 101 deaths out of 550 confirmed as of Sunday. And the detail that stops me cold. Protesters in Bunia carrying a mock coffin against a US-built quarantine center.
That protest is the field problem, Daniel. We just heard the FEEC declaration this hour, but you can't trace contacts in a community that's marching against your facility.
Right, and the AP names it plainly. Attacks on health workers, armed conflict in the hotspots. Responders are dealing with trust, security, and people actively pushing them out.
And hold the number precisely. 550 confirmed Monday in this report. Reuters has nearly 600. Same outbreak, 2 situation reports, and Congo's own officials say the true count runs higher because it was caught late.
So the real toll is somewhere north of what anyone's printing. That's the part that should worry people.
The Eastern Herald writes,
He was careful not to catastrophize. The scale-up, he said, is on track. New laboratories have opened in Mongwalu. More are coming. But on the metric that epidemiologists treat as the decisive threshold for outbreak control, he was unambiguous. The response is still behind.
The emergency declaration is the headline today, but the number underneath it is on a whiteboard in Bunia. Contact tracing at 45% of confirmed cases. WHO's own field director says that's half the threshold needed to stop spread.
So WHO declares its highest level emergency the same week its own director admits the field math is this far behind. Sarah, what does the declaration actually add if tracing is sitting at 45%?
It can unlock funding and emergency use pathways, and it gives WHO more formal coordination authority. But you're right, it doesn't trace a single contact. And hold the number carefully. This Eastern Herald report has 550 confirmed in DRC as of Monday, 101 dead. Reuters today says nearly 600. Same outbreak, different cutoff. Name the gap, don't average it.
And what makes 45% so brutal? There's no licensed vaccine for this Bundibugyo strain. So even the dose argument we'd usually be having, there are no doses. It's all foot-by-foot tracing, and they're hitting half the cases.
If you come to Ebola Watch for clear outbreak updates, you may also like Hantavirus Watch. Daily coverage of the 2026 outbreak, including the MV Hondius Andes virus cluster, CDC and WHO response, contact tracing, and traveler risk. Find it wherever you listen to podcasts. Links to all the stories we covered today are in the show notes. If one caught your attention, you can follow it there and read more. That's Ebola Watch for today. This is a Lantern podcast.